Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear an endocrinologist discussing diabetes management with a patient, Mr. Peterson, who is struggling to control his type 2 diabetes. For questions 1 to 12, complete the notes with a word or short phrase that you hear.
Good afternoon, Mr. Peterson. How are you managing your diabetes lately?
Honestly, it's been challenging. My glucose levels are all over the place, and I've been feeling tired and irritable most of the time.
I see. Let's start by discussing your medication. Are you taking your metformin regularly?
I've tried, but I sometimes forget the evening dose, especially when I'm working late shifts.
That could be a reason for the fluctuations. Consistent dosing is critical. How about your diet? Have you been following the low-carb meal plan we discussed?
Not as strictly as I should. I've had several family gatherings recently, and it was difficult to resist all the sugary desserts.
I understand that maintaining a strict diet can be hard. However, it's essential to limit refined sugars, especially given your recent HbA1c levels. Have you been able to exercise regularly?
I walk about 30 minutes every other day, but my knees hurt if I do too much.
I recommend switching to swimming or cycling, which are easier on the joints. We'll also need to adjust your medication. I'll introduce a GLP-1 receptor agonist, which should help with both glucose control and weight management.
That sounds good. What about side effects?
You may experience some nausea at first, but it usually subsides. Let's monitor your response closely and schedule a follow-up in 6 weeks.
Extract 2. Questions 13 to 24. You hear a respiratory specialist advising Mr. Lewis, a patient with chronic obstructive pulmonary disease, about managing his symptoms and adjusting his treatment. For questions 13 to 24, complete the notes with a word or short phrase that you hear.
Mr. Lewis, how have you been feeling lately? Have there been any changes in your breathing?
I've had a few bad days recently, Doctor. I wake up short of breath, and I've had to use my rescue inhaler more frequently.
Have you noticed any specific triggers like dust or cold weather?
Yes, the cold mornings make it worse, and being around smoke doesn't help either. I try to stay indoors, but it's not always possible.
It's essential to avoid those triggers as much as possible. Are you using your long-acting inhaler regularly?
I try, but I sometimes forget the evening dose. I also feel like the medication isn't as effective as it used to be.
That can happen over time. We may need to adjust your medication. I'll prescribe a combination therapy with a long-acting muscarinic antagonist and an inhaled corticosteroid. This should improve your lung function and reduce inflammation.
Will there be any side effects?
You might experience dry mouth or a sore throat, but they're usually manageable. Let's also consider pulmonary rehabilitation to help you build stamina and improve breathing techniques.
That sounds helpful. When should we start?
We'll begin the program next week and monitor your progress closely. I'll also schedule a follow-up in 4 weeks to see how you're responding.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, a B or C. which fits best according to what you hear. Question 25. You hear two doctors discussing a patient with rheumatoid arthritis.
Even though the patient has been on methotrexate for months, her joint swelling and morning stiffness haven't improved much.
That's concerning. We may need to consider switching her to a biologic therapy soon, given her limited response.
Agreed. But before making any changes, we need to run more blood tests to rule out potential infections or contraindications.
Absolutely. We'll also review her liver function results to make sure the methotrexate hasn't caused any complications.
Question 26. You hear two nurses discussing a patient's post-surgical wound care.
The wound edges still look inflamed, and there's been some minor discharge today.
That's not a good sign. We should increase the frequency of the dressing changes to reduce the risk of infection.
I agree. If it doesn't improve by tomorrow, we may need to notify the doctor and discuss starting antibiotics.
Good idea. We should also educate the patient on proper care to prevent further complications.
Question 27. You hear two pharmacists discussing a patient's prescription.
The patient has been prescribed tramadol along with an SSRI, which raises a concern.
Yes, that combination could increase the risk of serotonin syndrome, which can be dangerous.
We should contact the prescribing doctor to discuss possible alternatives or dosage adjustments.
Agree. It's better to address this early to prevent any serious interactions.
Question 28. You hear two physiotherapists discussing a patient recovering from knee surgery.
Mr. Lee is still hesitant to put full weight on his leg during walking exercises.
That's understandable, but we need to address it soon to avoid delaying his recovery.
I think pool therapy would help. The buoyancy will allow him to practice without stressing the joint.
Good idea. Let's arrange a session next week and gradually increase his load.
Question 29. You hear two doctors discussing a patient with heart failure.
The patient's heart function hasn't improved with the current beta blocker dosage.
We could increase the dose, but we need to monitor him closely for bradycardia.
Exactly. Let's track his heart rate, especially during the first few days of the adjustment.
If his pulse drops below 50, we'll need to revise the treatment plan immediately.
Question 30. You hear a doctor and a nurse discussing a patient's oxygen therapy.
Johnson's oxygen saturation dropped again last night, even with the CPAP machine in place.
That's a concern. We should increase the oxygen flow rate to see if that stabilizes him.
Should we also schedule an arterial blood gas test to assess his oxygen levels more precisely?
Yes. Let's reassess him tomorrow and decide if any further intervention is needed.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a geriatrician giving a presentation on the challenges of managing elderly patients with multiple chronic conditions.
Good afternoon, everyone. I'd like to discuss the complexities of caring for elderly patients with multiple chronic conditions, which is becoming increasingly common. One major challenge is polypharmacy, where patients take 5 or more medications daily. While each medication might be necessary, the cumulative effect increases the risk of adverse drug reactions, especially in patients with cognitive impairment. It becomes difficult to monitor side effects or interactions effectively, particularly when patients see multiple specialists. Another issue is that many elderly patients struggle with medication adherence. Some skip doses unintentionally due to forgetfulness, while others deliberately avoid certain medications because they experience side effects, like dizziness or nausea. These disruptions can worsen their conditions, such as hypertension or diabetes, and increase the likelihood of hospital readmission. Moreover, managing coexisting conditions like heart failure, chronic kidney disease, and diabetes requires close coordination between primary care physicians, cardiologists, nephrologists, and endocrinologists. Communication among these specialists can sometimes be fragmented, leading to inconsistent care plans, which confuses both patients and caregivers. Lastly, lifestyle interventions, including dietary modifications and physical activity, remain critical but are often overlooked. Many older adults have limited mobility, which makes exercise programs challenging. However, even light activities, such as walking or chair exercises, can be beneficial. In the end, effective management requires a multidisciplinary approach involving doctors, pharmacists, dietitians, and physical therapists to ensure both physical well-being and quality of life for elderly patients.
Extract 2. Questions 37 to 42. You hear a psychologist being interviewed about the importance of mental health care for healthcare workers.
Dr. Taylor, can you explain the mental health challenges healthcare professionals face, especially since the pandemic?
Certainly. Healthcare workers have always been at high risk for burnout, but the pandemic significantly exacerbated the situation. Long hours, high patient loads, and the emotional toll of caring for critically ill patients have left many feeling overwhelmed. A major challenge is the stigma surrounding mental health. Many professionals hesitate to seek help, fearing it will be perceived as a sign of weakness. Another issue is compassion fatigue, where healthcare providers feel emotionally drained after prolonged exposure to patient suffering. This can lead to detachment from their work, affecting both personal well-being and patient care. It's important to acknowledge that healthcare workers are not immune to mental health issues like depression and anxiety. One of the most effective ways to address these challenges is through organizational support. Hospitals and clinics should promote a culture that encourages workers to take mental health breaks and seek counseling when needed. Flexible schedules, peer support programs, and access to mental health resources can make a huge difference. Lastly, healthcare professionals need to develop resilience strategies, such as practicing mindfulness or engaging in hobbies outside of work. These activities help build emotional stamina and create a sense of balance. Ultimately, improving mental health care for healthcare workers is not just about individual efforts, but also about systemic changes within healthcare organizations.
That is the end of the listening test. You now have 2 minutes to check your answers.
AVN Pharma Education.